Have you heard about 3D mammography? CHI Health was the first system to bring that technology to our area.
It's special because it increases cancer detection rates and finds more invasive cancers. Speaking directly to the vision, imagine better health.
Here this morning, CHI Health doctor and radiologist Katie Mendlick. Thanks for stopping by, Katie.
Hi.
Hi, thank you for having me.
Good to see you.
You know, this is such an important topic, and we're just getting done with Race for the Cure. It's been in the headlines a lot, but the number of women diagnosed with breast cancer each year, how many is it? And I guess at what stages are they? Is that cancer being diagnosed?
So a quarter of a million women are diagnosed with breast cancer each year. It affects so many of us because 1 in 8 women are diagnosed with breast cancer, and everybody knows somebody that's been diagnosed with breast cancer. With mammography, we hope to detect things at an earlier stage, ideally stage 0 or stage 1 breast cancer. With earlier detection, it becomes a lot less invasive and easier to treat.
I just had a relative diagnosed at stage 1, and it's a huge difference in the course of treatment compared to what we would have seen years ago, where you found something much later on. 3D mammography is intriguing, this technology that's available now. Exactly what can it do that traditionally, when we look at like 2D, something, what can you find with 3D that you couldn't before?
I think it's been one of the major advances in mammography. Instead of taking a static 2D image, 3D mammography takes pictures layer by layer. So a lot of times what we're looking for on a mammogram looks the same as the normal surrounding tissue. So we can detect cancers that are hiding in normal tissue. On top of that, a lot of women get called back for false positives, something that may look like a cancer that is not. And this can reduce anxiety and reduce that false positive callback rate.
Yeah, the 3D mammography, how detailed is this? I mean, the images that you get, we're taking a look at some of this, but you know, really, how precise and detailed is it?
So instead of having 4 pictures of a breast of patient's mammogram, 2 from each side, we can have up to 300 from each projection.
Oh, wow.
So we can slice through layer by layer. The detail is amazing. We can run and watch the images on a video loop. We can slow anything down. We can blow up pictures. And it allows us to get a better picture of the breast.
We're talking about affecting detection rates. We're talking about looking and being able to find more invasive types of cancer. What about women who have dense breasts, which is something else that they might not even know it, but with mammography, that's a point for a lot of patients.
Right. It gives additional peace of mind. We can, oftentimes for me, from a mammographer standpoint, when somebody is very dense and they're just wide out, it allows us to look inside some of that dense tissue. We can increase the sensitivity of cancer detection up to 40%, particularly in women with dense breasts, but not just dense breasts, all women.
That's huge.
And then the cases where this cancer was detected early, are you seeing more of those cases being detected earlier?
When we first got this technology, we were amazed at the number of cases that we were detecting that you couldn't otherwise see on a standard 2D mammogram. The nice thing is when tumors are detected smaller, patients have a chance of avoiding more invasive testing, more invasive treatment like chemotherapy. Surgery is required for most people, but it's nice when we can detect things smaller and avoid chemotherapy.
So who do you recommend it for when patients come in? I mean, is it everybody? Is it the best fit for all women or just some?
Studies have shown an increase in cancer detection in all women, including those with not dense breasts or fatty breasts. I would recommend it for all women.
But if you have a family history, like when you have some of those other things working against you, where you sort of feel like it makes even more sense, because a lot of people go, yeah, but what about the cost? Like, is it more than 2D?
Insurance too. Is insurance cover 3D mammography?
We're hoping. Cigna is the first major national insurer that has picked up coverage for 3D mammography. There's 2 others that have followed. Medicare is covering 3D mammography. We're hoping some of our local insurers follow suit, because ideally 75% of women diagnosed with breast cancer have no family history. So this is beneficial for all women.
I'm glad you make that point, because it counters what I had said, where it's that conventional thinking that if you don't have a family history, then maybe you're not Where is it available right now? Because we said you were the first to bring it to the area. Where do we find it within the world of CHI Health?
We have had it since 2013 at Lakeside. We now have the technology available at Emmanuel, at Bergen, and at Midlands. It's coming to Mercy. There are other facilities in town that have now brought in the technology also.
Should you ask for it as a patient when you go in for your next mammogram? Should you ask specifically for 3D, do you think?
I would. Most of the patients, when they call to schedule their mammogram, they're asked if they want the additional technology.
Yeah, well, for those patients out there that are scheduling those, they can go to chihealth.com, that's the website, and then there's a backslash breast-care that they can go to. And when they schedule those, anything in particular that they need to do and with insurance to make sure it's covered, and they have that discussion?
They may want to discuss that. They may want to call their insurance company to find out
Get that checked
coverage.
out, yeah.
Would you talk just broadly while you're here, because there have been so many headlines about mammograms the last couple of years. What is your professional opinion on when women should start getting them?
My professional opinion is that all women should have mammograms beginning at age 40 and yearly until, if we were to find something, they wouldn't be healthy enough to do something about it. Now, that should begin earlier for people that have a significant family history. By 25 to 30, if you have a relative that was diagnosed under 40, a first-degree relative like a mother or sister, but all women, regardless of family history, should begin at age 40. There's been some confusion of that. It's as an effort to cut costs in medicine, but screening mammography works. Breast cancer death has been reduced 30% since the adoption of widespread mammography.
Can't argue with the facts on it. And when it's your life, when it's somebody you love, and you've got this technology available, again, where we're affecting early detection, but then also you see that number, 40%, when it comes to more invasive forms of cancer. It's awesome. And to think that it's here in Omaha.
Yeah, and that 3D mammography may be the standard of care somewhere down the road.
Dr. Mendlick, thank you for being here.
Thanks, Doctor.
We've got one of
Thanks
her
for having
colleagues
me.
that's going to be joining us
Later
here.
in the show, yeah,
it's
that's
like
right.
CHI Health Day here on the Morning Blend. But next,
Thank you.
something called Easy